Good morning, everyone, and thank you so much for joining us today for the TRIA Women's Sports Medicine Program Coffee and Chat featuring Medical Director of Sports Medicine of TRIA, Dr. Heather Cichanowski, and Sports Medicine Physician at TRIA as well, Dr. Heather Bergeson. We are so excited to have you both here today, and without further ado, I will let you guys start your presentation. I can't wait to hear more about the program.
Yes, thank you, Abby. Thanks for inviting us to speak, and thank you, everybody, for taking time out of your morning to join us. So, I am Heather Cichanowski. I'm a primary care sports medicine physician, and I'm director of the Women's Sports Medicine Program, and I am home-based out here at TRIA Woodbury.
And I'm Dr. Heather Bergeson. I'm co-director of our Women's Sports Medicine program at TRIA and out of the Bloomington location.
Okay, so we were both very excited to talk to you all about the program. So we are going to be talking about the overview of the program, what it is, who's involved, and also we're going to talk about what makes this program unique and all about the patient experience. And interwoven throughout this entire presentation, we're going to speak to why a comprehensive approach to care of the active female is so important. And then my colleague, Dr. Bergeson, will be finishing up the presentation, talking about what we have done, what we are doing, and our amazing community partnerships and future direction. So here we go. So one of the biggest questions we get is, what is women's sports medicine at TRIA? And this is what it is. It's a program that brings together a multidisciplinary team of sports medicine and orthopedic professionals to offer a comprehensive and collaborative approach to the care of the active and athletic female of all ages and abilities. And so that is what the program is in a nutshell. And we are going to break that down here to talk more about all the pieces. But you can't have a phenomenal program without a great mission statement. And this is our mission statement. And I'm not going to read this word for word. I'll just give you a couple seconds for you to read this. But I do want to focus in on that second statement where it says, in the area of female musculoskeletal and sports medicine concerns, we want to become a national leader in care delivery supported by clinical research and education. Now, later on in the talk, Dr. Bergeson will talk more about this, but most of the research that we have on sports medicine and exercise medicine has all predominantly be done on males. And so we've taken the results from those studies and simply applied them to females, but not always with great outcomes or the right care. And so finally, more research is being done on active female populations, which is fantastic. And we at this program are absolutely committed to staying very up to date on that and using the knowledge that is learned and apply it to our patients that come through the program. So this is the core team of women's sports medicine. So you have me, Dr. Bergeson, one of our lead orthopedic surgeon is Dr. Caitlin Chambers, our sports dietitian, Jillian Tholen. We have our lead physical therapist, Pete Larson, and our research investigator, Dr. Christy Pop. Okay, so more on those involved. So we have our sports medicine physicians. We have both our non-surgical providers, like me, Dr. Bergeson, who have the expertise in those diagnoses that we see more often in active females. And then we have our surgical providers, our surgeons that really do have an awareness of surgical considerations and techniques that may benefit certain characteristics of female populations. And you can see those listed there. We have our physical therapists. Of course, we have Pete is our lead physical therapist, but we have physical therapists involved with the program throughout the entire metro, TRIA Woodbury, St. Paul, and Bloomington, and they all have their skill set and bring forth some amazing knowledge specific to active women, whether that's running form evaluations or pelvic health and pelvic floor, helping a woman get back to activity postpartum, and the list goes on and on. We also partner with some of the existing specialized programs that TRIA has, namely a running program, the patellofemoral kneecap program, And one area we would like to expand on more is an exercise and pregnancy physical therapy program. We have our research investigator, Dr. Christy Pop, and her research really focuses on bone health and stress fractures. We have some athletic trainers that work in our clinics that help with care coordination education. And then we do a lot of collaboration with other specialties. TRIA has a physician assistant whose name is Andrew Kozad, who works at most of the TRIA locations, who really is a bone health expert. So he provides great bone health counseling and does postmenopausal medication management. We also have partnered with endocrine, obstetrics, gynecology, and for any eating disorder concern, we partner with Melrose. I want to take one moment to spend a little bit more time on our sports dietitian, Jillian. She does have her sports dietetics certification as well, but her knowledge base and breadth is quite wide. And again, I'm not going to read all of these, but just to give you a sampling of the issues she can help with, whether that's a sports related injury, recovering from an eating disorder, or for example, a female that loses her menstrual cycle due to underfueling. She can help correct that energy imbalance. Any active person with stomach issues or questions about special diets, helping a woman get back to activity postpartum. So she has been a fantastic resource for the program. So what are some of those key areas that we do see in women's sports medicine? I mean, kind of in a nutshell, we pretty much will see everything, but to highlight some of those areas, we see any bone stress injury, kneecap pain and instability, groin, hip, buttock pain, any active individual that may have concerns about the female athlete triad or REDS. Some of you may have heard of these, but this is when a person is not eating enough for how much activity they're doing, and then their own bodily systems really start to suffer. So a woman may have some menstrual irregularity, may have some bone health issues, may have recurrent injuries, may even have some mood issues, all because of underfueling. And we also love to see any active female that simply has more questions about how her physiology, anatomy, nutrition may be affecting her injuries and how she's able to train. And our surgeons, of course, see their respective surgical subspecialties, whether they're more of a hip specialist or a shoulder specialist or knee. Now, when it comes to who can come to the program, it's really open to anybody. So age, there's no limits, but Dr. Bergeson is a pediatrician. So anyone under the age of 8, I would recommend see her at TRIA Bloomington. And there's no activity criteria, meaning you don't have to work out so many hours a week or something like that to come to the program. Basically, if you self-identify as being an active female, you are absolutely welcome to come to the program. Okay, so what makes this program unique? Okay, why should you come see us here at this program? I mean, there's a lot of other orthopedic groups throughout the metro, and this is why, because all of us involved really take this comprehensive team approach to care. So basically, we all look at the bigger picture. We all understand that there's all these other aspects of an active female's life, like hormonal fluctuations, pregnancy history, nutrition, that can impact injury patterns and recovery. And I want to highlight that principle by just talking about this one particular study. So this was a study done on stress fractures in collegiate student athletes. So over 10 years, they kept track of how many athletes sustained a stress fracture. So over this 10-year period, you can see they saw 671 stress fractures. Rates were higher in women versus men. And you can see the sports there that had the highest rates, and foot and the shin were the most common location. And I don't think to anyone listening, this seems like a surprise. But what I do think is a bit of a surprising number is the recurrence rate. So over 20% of these athletes had another stress fracture in this time frame. And I feel that this happens because these injuries are undertreated. People haven't looked at the whole picture to really comprehensively treat them. Meaning if someone has a stress fracture and you say, okay, why don't you use crutches for 6 weeks or whatever time frame, that stress fracture heals. But if you don't try to figure out why did it happen in the first place? Was it a training error? Was it a hormone imbalance? Were you not eating enough? Then these injuries tend to happen again. And so at the Women's Sports Medicine program here, we really look at this from the whole picture to try to truly treat it so it doesn't happen again. And so other principles that makes this program unique is that we really have an injury reduction and prevention focus. So we want to give everyone the tools they need to keep from getting injured again. And we have a big emphasis on education and understanding. We've made 4 specific handouts. You can see them listed there that we hand out to everyone coming through the program, plus other information. And we also really procured a phenomenal list of resources for the active peri and postmenopausal women. So what is the patient experience? So someone comes in, sees me, sees Dr. Bergeson. What do they get? Well, they all get this questionnaire. And what this is really getting at is all those other factors that can impact their injury and the ability to recover. So we ask about their menstrual status, hormonal status. We ask if there's any eating disorder history, any specific food groups that they might avoid or not want to eat. We ask about their bone density. And so we ask if they're training for something specific, because that is very helpful information. So this is a great questionnaire to really start to get at those other factors that really contribute to injuries and how they recover. We also give them the handouts and resources that I've already mentioned. And based on each individual's needs and their goals, we refer them on to where they need to go to comprehensively treat their issue, whether that's physical therapy, nutrition consult, maybe a bone health consult, and so forth. So tying it all together, if you were to take this one diagnosis of a bone stress injury and say, okay, how does this fit within the Women's Sports Medicine program? So we have the sports medicine physicians to recognize and treat the injury and to look beyond to comprehensively treat it. We have the physical therapist to guide an individualized program back into sports and activities. We have our sports dietitian to assess their fueling and, if needed, Melrose for eating disorder concerns, and then collaboration with any other medical subspecialty that may be needed as well. All right, so I'm going to pass this on to Dr. Bergeson.
Okay, thank you, Dr. Cichanowski. So an important part of our mission at TRIA Women's Sports Medicine is community partnerships and education. And we are proud to partner with several organizations in our community, and we'll highlight some of them here. So we provide the medical coverage for Women Run the Cities, it's a 5K, 10K, and 10-mile running race for women put on by Twin Cities in Motion. And we've been the medical provider for that event since 2022. We've also been invited to speak at colleges and events in town about female athlete health. Dr. Cichanowski just gave a talk at McAllister College recently about female athletes and menopause. We did a panel discussion for Minnesota Sports and Events Big Ten speaker series at the newly opened Bar of Their Own about female athletes across the lifespan, which was a super fun event. And we're collaborating with the Tucker Center for Research on Girls and Women in Sport at the University of Minnesota on their free online Coaching Her and Body Confident Sport initiatives. And if any of you watched the Super Bowl, there was an advertisement about Body Confident Sport, which is an online resource created in partnership with Nike and Dove to help girls feel more comfortable being active and participating in their sport. And so they aim to empower the coaches and athletes to celebrate their awesome active bodies and all they can do. And we are starting to help create some modules for their Coaching Her program about relative energy deficiency in sports, ACL injuries in women, and injury prevention. Next slide, please. And one of our biggest accomplishments was our first Female Athlete Summit that we hosted in March. It was a collaboration between Gopher Athletics, Tucker Center, and us, where we hosted a day-long conference about girls and women across the lifespan. And we invited local and national experts across many fields to speak about the issues female athletes come across in each phase of their life. I had the opportunity of giving the keynote speech along with Dr. Nicole Lavoie from the Tucker Center and about why focus on the female athlete. And then Dr. Cichanowski gave a talk there too about the importance of strength and muscle mass in older women. And it was an amazing day. It was really well received and attended. CARE 11 was there and covered it, and we hope to repeat it every 2 years. Next slide. So as part of our commitment to education, we've done several things. Dr. Cichanowski and Dr. Chambers authored a book chapter about patellofemoral or kneecap pain. We host an elective for medical students where they spend a month with us rotating through with the different providers and learning about the care of the female athlete. We have given many talks and have been featured in the media, both locally and nationally, and have been invited as guests on podcasts. We are also highlighted on an upcoming PBS documentary called Beyond Stigma, which is about mental health in female collegiate athletes. So more to come on that. Next slide. And then we are also really proud to serve as team physicians at the collegiate, professional, and Olympic levels. Dr. Cichanowski is the head team physician for U.S. cross-country ski team and has attended the Olympics in Beijing and plans on attending again in 2026. Dr. Chambers is the head orthopedic surgeon for our very own championship winning Walter Cup PWHL Minnesota Frost, and I am one of the Gopher team docs. Next slide. So research is another thing that we are involved in and think it's really important as as Dr. Cichanowski was saying earlier, there's limited research on females in general, and particularly in sports and exercise. And most of the treatment and injury prevention that we recommend has just been extrapolated from the literature that we have on male athletes, which is not necessarily appropriate. Many studies have shown that there is an increased risk in women of concussion, ACL tear, patellar dislocations, stress fractures, overuse injuries, and osteoporosis, among other things. And we think that's because women have different skeletal structure, bone mass, muscle mass, ligaments laxity, and hormone levels. And therefore, the treatment and prevention of these injuries may be different for females. But unfortunately, women are underrepresented in sports research. In fact, it wasn't until 2015 that the NIH created a new policy stating that sex and gender must be included as a biological variable in studies, 2015. So we've got a long way to come, a long way to go. But our women's sports medicine team is committed to providing the most up-to-date treatments based on female physiology and specific research. And this is especially important in our active peri and postmenopausal female population who are really just the forgotten ones. And these are those Gen X women who were the first to benefit from a lifetime of Title IX. And we are seeing so many more active women at that age who are seeking guidance about how to continue to be active and athletic, and we can provide that for them. And our research scientist, Dr. Pop, is currently doing a bone stress injury where we are actively helping her recruit patients for that study. And then one other thing that I didn't list here on the slide is that we're also collaborating with Project Play, which is a program of the Aspen Institute, to study how we can better implement ACL injury prevention programs. So we know that ACL injury prevention programs can reduce the ACL injury incidence by 80%. They're just not getting implemented. And so we're trying to figure out why that is and how to best implement them so we can prevent that devastating injury. Next slide. So the key points about our women's sports medicine program is that we are inclusive in our care, and we will see almost any musculoskeletal and sports medicine issue for female athletes of all ages, and we provide that comprehensive care. We collaborate with across service lines for all of our women's service lines at Park Nicollet. And it's important to note that women are the drivers of their family's medical care. And when they receive an exceptional experience, like we're going to give them at our TRIA Women's Sports Medicine program, then their entire family may seek care with TRIA and Park Nicollet. Next slide. So for future directions, we're still trying to build program awareness and increase our online presence. And that has been hard to do without a dedicated marketing team. But we have been able to steadily increase our volume, especially when we implemented the ability to schedule online. And you can see from this chart here that once we started scheduling online, there towards the right side of that chart, we really increased our volumes quite a bit. And it's important to note that we have female patients traveling from across the state to see us. And we really are the only program in the Midwest providing such unique comprehensive care. So ideally, we'd love to have a dedicated program coordinator who can oversee our social media presence, coordinate across our sites and with our community partners. So that's still a work in progress. Next slide. So we want to continue to build strong connections with our Nicollet and health partners who provide such comprehensive care to females. And historically, there has been a gap in that care for orthopedics and sports medicine, but we want to fill that gap, and we really are doing just that. And then next slide. So here's where you can find us. This is our email and website and the locations. And then on our next slide, just the best way to schedule is online, but you can still call old-fashioned the number and ask for any specific provider if you know who you want to see. I tend to take care of the younger population, but I will see all ages. And Jillian Tholen, it takes care of ages 13 to 64, but we always just tell patients to check with their insurance because each is different about how they cover dietitian services. So that's all we have today. We're really happy that you joined us, and if you have any questions, we can open it up for that.
Thank you so much, Dr. Cichanowski and Dr. Bergeson. I do have a question right off the bat that I wanted to ask. When you were speaking to the research studies that are currently being conducted, and just the fact that there's been a disparity between research studies conducted for male athletes versus female athletes, do you have any details or initial plans on the types of research studies you hope to do in the future for female athletes at TRIA?
A lot of it is about bone stress injuries because that's one of the most common things that we see. So both bone stress injuries and then ACL injury prevention is what we're focusing on now.
Okay. Perfect. And then another question I have for you guys is, futuristically speaking, before I ask my question, I loved seeing like the level of community involvement that you guys have across the metro. What role do you think philanthropy could play in helping to carry out your mission for the TRIA Women's Sports Medicine Program in the future?
Chick, do you want to take that?
You can take that, Heather.
What we'd love to do at some point is apply for a grant to be able to, as I was saying before, really increase our social media presence and our marketing. We have so many really cool ideas about messaging and education that we can provide for a community. We just don't, Dr. Cichanowski and I are both clinical docs. We don't do a lot of our own research but we help collaborate and with our research scientists to do that. And when we don't have backgrounds in marketing to be able to put out really nice, memes on social media, but that is something that we would really like to do. And so as we think about future for us, then applying for some kind of grant through Park Nicollet Foundation would be a really helpful thing for us to help expand that reach. So that's one of the things. And then also just the work that we do outside of our busy clinical practices, it takes time and energy, but that's where those community engagements are really where I find it to be really rewarding and trying to make those connections with people. And so if there's anybody that is listening to this that has ideas about, oh, I've got this organization that seems like it would be a good fit to connect us, we're always looking for those ideas as well.
Thank you so much. And I loved hearing about the fact that both of you are such active women. Is that what inspired you to become sports medicine physicians, or what makes you really passionate about the jobs that you do and the work that you do?
Yeah, I think that's definitely a part of it. I mean, we've both been active throughout our lives. We're part of that Gen X generation that was able to benefit from having opportunities, back in high school and even younger. But also too, as we are that first generation that's going through that kind of perimenopausal, menopausal transition, part of it's just really want to know, okay, what's out there for us? How can we help support other women like us going through all of this in a way so we can keep on being active and healthy. So yeah, that's definitely been a driving force.
Yeah, same.
I also just wanted to say too, based off of that last question, I think program awareness has always been, it's probably been a biggest challenge for us because we have a great product, we're passionate, all of our key players within the program, love what they do, but you can kind of have the best thing in the world, but if no one knows about it, I mean, word of mouth certainly helps, but that's slow. That's kind of a slow way to build. So we are in this day and age, people get their information on social media. I mean, I think that's just what it is, and I think we have to kind of keep up with the times and how people hear about programs and new things that are going on out there. So yeah, that's always an area that we're looking to improve and expand on.
Thank you. And Dr. Thorpe, if you could enter your question into the meeting chat, that would be great. And then I know there were a few other questions as well. What are some common barriers to access and care that you see with your patients?
Back to the awareness, if they don't know to seek us out. Although we get a lot of referrals from within our program, so that there might be a patient that comes in through the acute injury clinic, and that we try and do a lot of education for our own docs to say, hey, we've got this program. So if you've got a woman, let's say, that has a stress fracture, send them to us for follow-up so that we can really dig deeper and have the time to do that. So I don't know that really answered the question there, but that's what came to mind.
Thank you. Another question we have here is, in what ways do you partner with the health partners and partner women's centers? I know that you had spoken to the fact that you want to broaden that partnership, but what does your partnership look like right now?
One of the things that we do with the hand or the questionnaire that they fill out is we talk about menstrual health and menopausal symptoms. And so if there is a woman that's struggling with the menopause transition, then we'll say, hey, maybe you should think about going and seeing one of the gynecologists or the providers that does hormone therapy to have a conversation about maybe that could help. Maybe that could help with your vasomotor symptoms or your joint pain or whatever that is. Or if it's somebody that we identify that really still has an ingrained eating disorder that seems like it needs more than our medical expertise, I will manage some of them if they're in recovery or really medically stable. But if I don't feel like they're medically stable or needing more dietary support outside of what our sports dietitian Jillian Tholen can do, then we'll have them go to Melrose. So those would be some examples.
And I would say too, honestly, those relationships are a bit more informal, just like Dr. Bergeson was saying. If something is flagged on our end, we refer on. But one of the goals is to have a more formal relationship with both the Park Nicollet Women's Center and the Health Partners Clinics for Women. And one of the things that I'm actively working on right now is just trying to get us on those websites, right? Health Partners has several websites for women's specialty care, and one is for Park Nicollet Women's Health Center, and it lists all the specialties that are offered. But one of our last slides in the presentation, where there's been classically that gap in the orthopedic and sports medicine side. So I'm actually actively working with Andrea Winter and her marketing contacts and trying to get us connected to the websites. So that's kind of step one on that. But that is definitely something we want to continue to build relationships with to formalize a bit more.
Thank you so much. And Dr. Thorpe asks, what do you have to offer older post-menopausal women who are interested in really recovering from and even preventing the arthritic symptoms that come with aging? For example, better post-op overall improvement after joint replacement.
Well, I think for one, so we have, we've procured this really nice list, on books, podcasts, resources on anywhere from strength training to nutrition, that both Heather and I have vetted out. So it's good, reputable information. So we hand that out. We do a lot of education on those things, right? That nutritional piece is huge. Women in general still tend to undereat. maybe not having enough protein, you need more protein with aging. So there's a lot of tips like that that we educate on, partnering with really good physical therapists who honestly aren't, quote, afraid to work with an older women. I mean, we don't want people treating older women as fragile. I mean, that's the exact wrong thing to do, right? We need to get women strong, confident, and again, we have good physical therapy partners that will do that with that demographic. So that's how we kind of attack we kind of attack that from all of that angle. Yeah.
Yeah, and we really talk about the concept of the importance of lifting heavy, especially in the postmenopausal transition, and our physical therapists can help program that too. So I think that motion is lotion, keeping moving and keeping strong are the most important things that we can be doing for our aging athletic population.
I think a lot more has developed with menopausal replacement therapy, right? As some of the data has been all relooked at, and sometimes that can help with generalized aches and pains in that peri and postmenopausal transition as well.
The other thing I would say too is that we all focus a lot about these as we go through these transitions in our lives. There's these touch points, so puberty and pregnancy, and then post menopause area where our bodies are changing, and that can be really hard when we live in this age of toxic diet culture and fitness culture and anti-aging culture. And so trying to come together and say, hey, that we need to eat intuitively, move our bodies mindfully, and see those the biases that we have in our society for thinness and for youthfulness, and really try and say, hey, this is how we can continue to age as healthy and athletically as possible.
Mm-hmm.
You brought up a really good point that actually was something that I wanted to ask you guys about with the biases out there, with like you were saying, like overall promotion of youth and anti-aging and a certain body type. Do you encounter that a lot with your work with women, trying to help them see through those biases and stuff like that? Is that a pretty common thing that you encounter with your patients?
Every day.
Yeah, that's every day.
Yeah.
Wow.
And
So,
I
think
also so that just to put this out there, I provide a weight inclusive care. So I don't weigh my patients. We don't talk about weight loss or diets. We talk about healthy lifestyle behaviors and the importance of that intuitive eating, trusting your body. It knows what it needs. And as long as we're fueling it appropriately, and which, as Dr. Cichanowski was saying earlier, we as women tend to undereat and not fuel appropriately. So intuitive eating, trusting your body, and then it's gonna then be there for you and drive you in all the things you want to be doing.
I think a lot of it too is saying, don't focus on what your body looks like, focus on what your body can do, right? It's a lot of empowering that way. Also validating, right? I mean, that postmenopausal time frame is very, very difficult and challenging. Up until now, it's literally not been talked about at all. It's finally being talked about. And so knowledge is power. There's a lot of validation knowing that, oh, hey, yeah, my brain fog, me forgetting all those words really is hormonally driven. So I think we really try to educate on that as well.
And I think too that a lot of the women that we see, the Gen X population, are just cardio junkies. We just want cardio. And what we know is that really it's more about the strength piece. And so as much as we try and steer women away from worrying about their little extra belly fat, which I always tell them is like a lifesaver, like that is that as we enter menopause, we lose about a third of our bone density. So our bodies are doing a really important physiologic thing by hanging on to a little belly fat to have some more estrogen circulating for our bones. And so we really just want to be focusing then about, okay, how are we going to strengthen and keep muscle mass and bone density? And the cardio, it's important for sometimes, but we say like 2 to 3 times a week for cardio or HIIT, and then 3 to 4 days a week of strengthening. So it really needs to be more strength focused now as we age.
That's fascinating. Thank you so much, both of you. And there was one other question here. Let me see. Just need to scroll. One moment. Yes. Is TRIA Women's Sports Medicine program unique? Do other orthopedic groups across the Twin Cities offer similar programs?
So basically, no. Now, you might have other orthopedic groups kind of hanging a shingle or having something on their website that says, oh, we have a women's sports program, but it's typically just one doctor that says that's what they do, right? It's not this comprehensive approach. It's not having the sports dietitian, the physical therapist. It's not having those connections with other specialties. And so it really is unique in this Midwest area.
Which is what TRIA has always done. We've been the leader in the model of care that TRIA has provided as a multidisciplinary, freestanding surgical center, and then the first with Dr. Cichanowski created this program so many years ago. It was the first in the region. So and continues to be, I think, the most inclusive, comprehensive, and best program.
That's amazing. I just speaking for myself, at least, the work that you do to empower women and to set them up for success at all different ages of life is amazing. And I think that it's really special and very important that you guys do the work that you do, but also help women have a healthier body image and image of their health. And so thank you for all the amazing work that you do. And if anybody has any other questions post this presentation, would it be okay if I forwarded them on to you?
Of course.
Oh, sure, yeah.
Awesome. Well, thank you very much for your time today, and thank you all for attending, and we will have the recording out soon, but in the meantime, have a wonderful day.
Thank you. Everybody. Bye, everybody.
Thank you.